Today we're joined by Jim Haines, the Chief Compliance Officer and General Counsel for American HealthCare, and a board member of HealthCap, I might add. Jim, thanks for joining us. Appreciate you taking the time and making the effort to join me in a conversation. So thanks and welcome.
Well, thank you for having me. I'm looking forward to talking with you.
It goes without saying, but apparently I'm going to say it, that the last 17 months has been amongst the most challenging times for the country in a century, but for the industry in particular as well. Any particular lessons that you guys have taken so far out of just reading and reacting to essentially a once in a century pandemic?
As we were going through the pandemic, HealthCap was issuing weekly what you need to know emails. Those were so helpful. My vice president of quality improvement and clinical services, I remember the first time I sent her one of those emails, she just was thrilled and she said, "This is great. Please keep sending these to me. I'm going to go through it in detail every week." You or HealthCap really did step up to the plate when it came to COVID. I felt very supported. And who would expect that kind of support from your PLGL carrier? It's just not something that you expect. It's something that you did, and I can't tell you how much we appreciated that and used it to help us get through COVID.
So how long has American HealthCare been a part of HealthCap?
HealthCap's been on American HealthCare's radar for years, and then when we did the HUD refis and a change in our board, we moved over to you in 2016. And I've just been continually impressed with the way that claims are handled. You've assigned a couple of excellent claim managers to our company. I can't compliment you enough on the way that they continually interact with me. They know my background. They know I want to be involved. They know I like having some input into what outside counsel we're going to use on a case. And I'm always asked what I think or how we should proceed, or if a decision's made, "Jim, do you agree?" Back before 2016, I would get sort of hypertense when I got into an intense claim, and now I just feel relaxed because I know that it's in good hands and it's being handled in a very efficient and productive manner.
We're bumping up against HealthCap's 20th anniversary. When I say that, what comes to mind?
We went with HealthCap in 2016, and since going with HealthCap, my response to that 20 years is I can understand why HealthCap has been successful, and I anticipate and fully expect that it will become even more successful because of the partnership that you create with the people that you insure. It's not just an insurance company. You support us in ways that other companies just don't.
Well, we certainly appreciate your participation, your membership, and also your input, and appreciate you contributing as well on the board. So, Jim, thanks for that, all those things, and thanks for joining me today. I really, really appreciate it.
Thank you. I've enjoyed it.
Thanks.